That's London.
Thank you, Speaker. Speaker, my question is to the Minister of Health and Long-Term Care. Speaker, Connect for Mental Health, an inexpensive program proven to help psychiatric patients leave hospitals and successfully reintegrate into communities, has been dropped in London. The $106,000 program saved London hospitals roughly $2.9 million a year and provided an overlap of hospital and community care during discharge. Unfortunately, due to this government's healthcare cuts, scandals, and the freezing of the hospital budgets for the last 4 years, this program that saves healthcare dollars cannot be funded. Due to the financial mismanagement of the scandals of this government, healthcare services are being crowded out. Mr. Speaker, how long will Ontario suffer due to this government's incompetence?
Minister of Health, Long-Term Care.
Thank you, Mr. Speaker, and I appreciate the question. Certainly the provision of strong, high-quality mental health services in the London area is extremely important to this government. I was proud, in fact, not very long ago, with the President of the Treasury Board, Mr. Speaker, to announce a new commitment of $1.2 million in London towards a brand-new mental health and addictions crisis centre in that city that will provide crisis intervention for adults aged 16 and up, Mr. Speaker. And this is such an important addition, being run by the Canadian Mental Health Association, Middlesex, as well as the addiction services of Thames Valley. It will work collaboratively. They'll work collaboratively, of course, with all of the healthcare providers within the community, providing that crisis assessment, stabilization beds, Mr. Speaker, and longer-term community supports.
Thank you. Supplementary.
Thank you, Speaker. Back to the Minister of Health. Minister, that program that you could operate could fund 2 crisis centres with that money saved. Mr. Speaker, it's unfortunate that this program is now getting lost in their own government's bureaucracy. Results from this program were released last year and found an improvement in the quality of life for mental health patients and a savings of $2.9 million. The Southwest Land has decided to work on developing a strategy for regional mental health, but that's expected to take up to 18 months to complete. The Mental Health and Addictions Advisory Council that you mentioned has struck a working group to review this with no timeline. In the meantime, this program is going to be lost in London. Mr. Speaker, the minister knows that this program has already been studied, and the evidence shows it works, saves money, and provides a better life for mental health patients. Will the minister show some compassion and save the program from the bureaucracy that this government has created?
Thank you, Mr. Speaker. And I know the member opposite, because he's alluded to the review that the LHIN is undertaking now for those important community supports. I know that he supports that review. It's important that we continue to develop strong, coordinated, collaborative programs. But I'm happy to announce, Mr. Speaker, that in fact this morning I instructed my ministry to ensure that interim funding is made available to this organization while this review, this important review, is ongoing, Mr. Speaker. So it's good news for London. It's important that in this review period, as we develop a comprehensive approach to mental health services in the London area, that this program is allowed to continue.